What we are seeing is a flipped medial meniscus. This medial meniscus is flipped and lying in the intercondylar area and over the medial tibial plateau. This is a large area of medial meniscus tear and flipped like this. It looks like a bucket handle. So it is called as bucket handle tear of medial meniscus. Normally this type of medial meniscus tear is seen with the ACL tear. Now what we are doing is we are opening the joint space and we are going to put it back in its position, and we assess the integrity after once it is in its position. There is a small radial tear component in the white zone, and the tear of the meniscus is at the capsule, that is red zone. It is just torn from the capsule. Whenever any meniscus is torn from the capsule, then if we stitch it back, then the results of the meniscus healing is much better than when it is torn in the substance of meniscus. Here it is torn at the capsule and meniscus junction. What we are doing is at the middle of the tear we are going to put one inside out needle. This is a single lumen cannula, and the stitch is going from one to the capsule and one to the red zone, that is a most lateral third of the meniscus. Once we try to pull this from outside, then this meniscus sits back, and continuously then we will continue to put the stitches from that point to the front or to the back. Now what we are doing is we are putting the stitch from the middle to the front anteriorly. We have put two stitches now, that is inside out needles. There is a space for another one. We are going to put one more stitch. Then this part of the meniscus which is behind, that is a posterior horn of the meniscus, we cannot put any inside out needles. Then we will be using all inside type of devices. Here what we are doing is just lateral to the root of the meniscus, over the posterior part of the meniscus we are going to put the all inside device. This will put the meniscus to the posterior capsule, and then meniscus is anchored back behind. So we have put three inside out needles and two all inside needles now. So this is over the superior part. Then two all inside out needles again we will be using to the inferior part of the meniscus. So this meniscus now looks like a normal meniscus, how it was there before tear, and when it is given proper rehabilitation and initial days of protection with the braces and protected mobilization, then it will go on to become like a normal healed intact meniscus, and the functionality of this meniscus will be restored. As I was telling, this person had a ACL tear. We are using all inside type of ACL here with tight ropes on both sides. This is the all inside ACL. We have made the all is flip cutter, tibial tunnel using flip cutter. This is the graft passage to the tibial side. This ACL is about 9 mm in thickness and very nicely positioned and shining. Now this completes the procedure of ACL reconstruction and the repair of the bucket handle tear of the medial meniscus. We will continue to do the sliding knots to all the inside out needles, and then we will check the integrity again. But once the ACL is uh, placed, we may not be able to open the joint how we were seeing before. So before only we would have done the repair, and then ACL is uh, placed now. If you have liked this, please like and don't forget to subscribe to my channel. Thank you for watching this video. Thank you.